Has your little one been recently diagnosed with an adrenal disorder? Adrenal disorder can cause fatigue, weakness, excessive thirst, urination, and much more. Here's everything you need to know about adrenal disorders. Adrenal disorders happen when the adrenal glands are not functioning properly. Adrenal glands are organs located in front of the kidneys. They are responsible for producing hormones including cortisol, adrenaline, and aldosterone. These glands are incredibly important because they work with the pituitary and hypothalamus glands to help regulate digestion, balance the immune system, and control stress reactions. If the adrenal glands secrete too much or not enough hormones, this will result in different types of adrenal disorders. Cushing's syndrome and Addison's disease are two of the most common adrenal disorders in your furkiddo. Cushing's syndrome occurs when your furkiddo adrenal glands secrete too much cortisol into the bloodstream. This is caused by large doses of steroids given to treat certain medical conditions for a long time. On the other hand, Addison's disease happens when there is insufficient amount of hormone, aldosterone, and cortisol. So what causes the adrenal glands to produce too little hormone? It is usually caused by an autoimmune disorder, which means the immune system starts attacking the body's adrenal system. This process leads to the malfunctioning of the adrenal glands and thus the lack of hormones. On the contrary, several factors may explain why your little one's Cushing syndrome produces too much cortisol. This condition can be caused by steroids that are given in high doses to treat medical conditions for a long time, such as autoimmune disorders, and can be caused by a pituitary tumor. If left untreated, this tumor may spread and turn into cancer. That's why it's important to watch out for signs of Cushing syndrome and other adrenal disorders. Cushing syndrome has distinct and unique symptoms. For example, your little one may have a pot belly, thin skin, or recurrent skin infections. They may also experience excessive panting, hair loss, increased thirst, appetite, urination, and decreased physical activity. However, it may be difficult to tell if your little one has Addison's disease because the signs are sometimes similar to other health conditions, such as inflammatory bowel disease. The symptoms of Addison's disease include fatigue, loss of weight, appetite, constant vomiting, diarrhea, increased urination, and increased thirst. Some pups might shiver and tremble like they're freezing, and some may even collapse. If you notice these signs, please visit a licensed veterinarian as soon as possible. Once diagnosed, veterinarians will prescribe medicines for patients with adrenal disorders to stop the excess production of hormones or increase hormone production. Some furkiddos may opt for surgery to remove the tumor for Cushing's disease. If the surgery is successful and the tumor is completely removed, there is a good chance that your little one can live a disease-free life again. However, since it can be a risky procedure, sometimes surgery isn't an option. So medication and drugs will be administered instead to manage the condition. On top of traditional treatment, natural and holistic supplements like NHV Supraglan can help support your furkiddo with adrenal disorders. NHV Supraglan helps regulate adrenal hormones, supports pituitary gland dysfunction, helps balance water electrolyte levels, and improves coat conditions. This vet formulated supplement contains herbs like borage and eleuthero, which helps restore the adrenal glands to their natural balance, and astragalus, which helps balance the immune system. If you have any questions about adrenal disorders or wish to find out which supplement suits your little one, contact one of our pet experts.